We're now starting to see 5-year survivals in the metastatic setting when men are treated with these more potent therapies. And a large number of men in my practice are doing very well, even past 5 years, even talking perhaps 7 to 10-year survivals. And these drugs, while they're life prolonging, can have real world toxicities for our patients, both on the cardiovascular system, but also on their muscular skeletal system, as well as mental health and bone health. So some notable side effects of the potent AR inhibitors, and that's Abi with prednisone, Enza, apalutamide particularly. We see higher risks of falls and fractures. You can see loss of muscle mass and loss of cardiovascular fitness. So it's really important to emphasize exercise regularly, 3 to 5 times per week, the more the better. Full body, CrossFit type exercises if you're able, walking if that's what you can do. It's very much personalized for what a patient can do and enjoys, so that they're doing it regularly, making it a habit, so that they're not losing muscle mass, not losing bone density, and putting themselves at a more vulnerable position for falls and fractures, which we do see. Monitoring bone density is very important as well, and the use of bone anti-resorptive therapies can be triggered based on the development of osteopenia or osteoporosis. With docetaxel, we see, clear side effects that can emerge, but then tend to resolve 6 to 12 months later. And so those are reversible, which is good news for patients. Other things that we do are home blood pressure monitoring. With all the potent AR inhibitors that we have approved right now, we see a higher incidence of high blood pressure and a slightly higher cardiovascular risk incidence, such as atrial fibrillation. So monitoring and treating high blood pressure, minimizing cardiovascular risk factors, getting men to stop smoking or to treat their hyperlipidemia is really important. And of course, exercise, getting outdoors, being active is good for mental health as well. And just paying attention to the other comorbidities, really important. And partnering with either a cardiologist or a primary care doctor, if you're a urologist, is really critical.